And like I said, guys, before, these are the symptoms that are with the late stages of dementia. The age group 85 and older has the highest rate of Alzheimer's cases reported. Like I touched on before, some of the symptoms I discussed in the previous slides, but we're going to focus a little bit more on specific symptoms that I want y'all to be aware of, such as memory loss, impaired judgment, difficulties with abstract thinking, faulty reasoning, inappropriate behavior, loss of communication skills. Some of the dementia that presents, the patients develop hallucinations, paranoia, and increased agitation. So like I was talking about, these symptoms, they do present much more in the middle stage of dementia. And like we were talking about, the mild stage of dementia, the patient really tries to hide those symptoms. But the earlier that they can be treated, that'd be the best case scenario. Someone with dementia symptoms may repeatedly ask the same questions, become lost or disoriented in familiar places, be unable to follow directions, be disoriented about the date, time of day, not recognize or be confused about familiar people, have difficulty with routine tasks such as paying the bills, and at this point they may have some poor hygiene issues. This is why it's so important for the caregivers to recognize these symptoms, to be able to identify whether the patient is having issues with dementia. Now typically these present later on in the stages of dementia. Patient begins pacing, walking, there's inappropriate dressing or disrobing. The patient has a whole lot of episodes of crying. It could get physical, it could get verbal. Patient may try to hurt themselves, they hide or hoard things. And this is why it was always or most commonly confused with a mental illness. And they're just symptoms of dementia. But it's very important to identify the treatment options for dementia. Okay, there's medical intervention, such as cholinesterase inhibitors, and these medications include Aricept, Razidine, Exelon, and they slow the breakdown of the brain chemicals involved in memory and judgment. Now, nothing can cure dementia. You can't grow back healthy brain cells, but medications that they implement whenever they identify and diagnose dementia, they slow the progression of the disease. A whole lot of these patients, they undergo the same treatment as, some of the same treatment as cardiovascular disease or vascular dementia. Occupational therapy is a plus if you can get it in the home to help treat these patients, because whenever I practice in the home, when I talk to the physical therapist, they always tell me if you don't move it, if you don't use it, you lose it, meaning muscle function. So it's very important that the patient remains active. Now, a whole bulk of my research from when I was constructing this presentation is that this affects the entire family. And it's important for the caregiver to recognize within themselves whenever they're having what researchers call caregiver burden. And this is this is a significant problem moving forward with this disease, because mom and dad, they want to stay home. Son and daughter don't want to put mom and dad in a 24-hour living facility, so it's very important that we find resources for this population to try to reduce the risk of caregiver burden. Because no drugs cure this condition, emphasis is put on the strategies that help delay the onset of severe symptoms, which are exercise, hobbies, and good nutrition. It's very, very important for the caregiver to learn how to manage these behavioral changes in the patient with progressively worsening dementia. Keep the tasks simple. Ask or say one thing at a time. Have a daily routine or schedule so that the person knows when a certain thing will happen. Very important in this population. Reassure the person that he or she is safe and you are there to help. Focus on his or her feelings rather than words. For example, you seem worried, and this will give the patient an opportunity to voice how they're feeling at that particular moment. Don't argue with a patient with dementia. It's always you don't want to escalate the situation. You want to try to fix or address the problem in a real mild, calm manner, because whenever a patient becomes agitated, there's a higher risk of the patient becoming combative or getting physical. The average time from onset of symptoms to death is 8 years in Alzheimer's dementia. Caregivers cannot stop Alzheimer's related changes in personality and behavior, but they can learn how to cope with them. And we discussed earlier on the previous slide some of the interventions that a caregiver can do to help manage some of the behavior changes in patients with Alzheimer's. Establishing a regular routine will help stabilize a patient with Alzheimer's disease mentally. Now, in our local community, there are 3 resources that I have leaned on in order to construct this presentation. One of them is the Alzheimer's Connected website. It's a free community that connects different caregivers with other caregivers that are dealing with the same issues. And this is very good because it supports one another. Nobody really knows what a caregiver that's taking care of their parent or loved one with Alzheimer's disease than another patient or another caregiver that's caring for a patient with Alzheimer's disease. And hopefully, whenever you connect this population, they can have different interventions that work for them that these caregivers can try. Another local resource that we have is the Advanced Rehab and Healthcare here in Vernon. They have a specialized wing at their facility dedicated to Alzheimer's and dementia. And whenever it becomes too much for the patient or for the caregiver per se, this is always an option for the patient. Another resource here locally is the Eagle Flats Village. It's an assisted living community, not specifically more for supervision or more like the advanced rehabilitation healthcare. It's assisted living, and what I really wanted to point out with this facility is that whenever a caregiver starts to exhibit some of the symptoms of caregiver burden, they can collaborate with Eagle Flats Village, and they have respite care that will watch or that will care for the patient for 24 to 48 hours, just depending on exactly what the situation is. And this will give the caregiver time to themselves where they can kind of regroup and get ready to care for them again. Is there any questions? No questions? All right, guys, thank you all for coming to this presentation. If y'all have any questions, y'all know how to reach me. Y'all have a great day.